Welcome to the Depth Perception Podcast.
We go in depth about the perceptions and misconceptions of optometry,
which includes the business of optometry,
social issues within optometry,
and life as an optometry student.
Coming straight from Dr. Jasdeep Singh Soni,
Dr. Nadia Afghami,
Dr. Douglas Akiti,
and Svetlana Nunez. We hope you enjoy this episode.
Hear ye. Welcome back, everyone, to the podcast, the Depth Perception Podcast. How have you guys been? It's been a minute.
It's daylight savings has passed. Spring is about to start. Can't complain. How about y'all?
Adulting, things are
Adulting.
Life after optometry school. You know what's funny? I thought that I was going to have so much time. I was like, I can't wait till after school. I'm going to have so much time for stuff. I have less time now. Because every day I started a new project or like doing stuff for the house. Today I was in the garden. It's been good weather in Nevada. So we're trying to take advantage of that before it gets really hot this summer and like do our yard. And then, you guys want a journey. And then, it's been, all work and no play. So missed you guys.
Missed you guys too. It's been a minute, but I'm glad we're back. We've all had a lot going on, but it's really nice to see your guys' faces. And so today, our podcast topic, we're talking about colors and scrubs.
Oh, wow.
And dressing. And
dressing. Dress to impress. So first I'll ask you guys, do you guys have a favorite color? Let's start there. What's your favorite color? Nadia, what's your favorite color?
Pink.
Okay. JD?
Blue.
My favorite color is blue also. Okay. So as it has to do with scrubs, do you guys wear scrubs in clinic? And if you do you have a particular color you always wear? Do you mix it up? What's the vibe, JD?
I got 6 colors. I got black Janu scrubs that I had to wear my first job, so I have like 5 of those. And then I have figs, including green.
Don't
salmon.
name names. No brand names. Don't flex, JD. Just color.
Okay. Right. I will undo the brands that I just said out loud. I have a certain company's scrub colors, including green, salmon, red, like maroon, and there's 2 more colors, which include light blue, baby dark blue, that kind of thing. What about you?
Yeah, I wear half the week, like I'll wear business casual because I like to be, I don't know, it just depends on my mood. Like sometimes I just want to wear something, like especially if I'm doing something after work and we're like, oh, we're going to dinner, or like I'm going back to my parents' house or something. And then if I don't, then I'll wear scrubs. But I have a lot of different colors. And I like the navy blue and then it's like a teal blue. I like those 2 colors. They're very complementary to my skin tones.
Okay. And for me, I mostly wear scrubs. I do mix it up throughout the weeks, but at my job, I guess we kind of have not really a dress code in terms of what colors you can wear, but technically they want us to wear like neutral colors throughout the week. And then on Fridays and Saturdays, you can wear whatever color you want. So I think for me, my favorite color, I have a bunch of different colors as well. My favorite colors are black and navy blue.
Do you look forward to Friday and Saturday so you could wear those fun colors?
Yeah, I like the fun color. My favorite fun color is that salmon pink. That fuchsia. That vibe. It's real fresh. It's kind of like this a little bit, but I think it's like this. Yeah.
I love hoodies, my favorite.
And so with that, did you guys know that there's a certain study that's been done? There's a thing about the perception of colors, and as it has to do with patients, how they perceive their doctors and nurses in terms of competency, likability, and trustworthiness. Did you guys know this?
I didn't know that.
All right, so if there were a color that you would think would be a no-go for patients, what colors would you think that patients wouldn't trust you in?
As a doctor or as like yellow?
If your doctor just had all yellow scrubs, not trusting that doc?
I'd be like, why do you look like a highlighter?
That's fair. JD, what about you?
I was thinking if the color of blood affects someone, or they think about it, but maybe they would think they would be more likely to deal with blood. Or white, maybe, because nobody can keep white clean, and then that makes it look bad if it's white and dirty.
Wow, like a psychopath.
Are there white scrubs? That does
I don't
feel
think I've seen
really
any.
like psychotic. That feels like you should be in the loony house, right?
Substitution, kind of.
Right.
You just walk in with your hands crossed and like it's like wrapped
Yeah.
already.
Okay.
Thanksgiving, early 2000s, Backstreet Boys music video.
So this study particularly talked about 4 different colors: black, navy blue, light blue, and green. Now, out of those 4 colors, Nadia, which color do you think is the most likable?
Navy blue.
Okay. And which one do you feel like would be the least?
What were the other ones?
You got black, navy, light blue, and green.
Light blue. Well, when you go to a hospital, like, aren't those the main colors? Like, the surgeons wear green, right? And then the ER
It depends.
doctors wear, yeah, because, okay, sorry, I know this is like a side tangent, but did you guys have in your schools like different scrubs for different grade levels or whatever?
For us, it was based on your program. So all optometrists wore a certain navy blue, and then different programs had different colors in that sense.
Because you had different programs
Yeah.
within your school, right?
Yeah.
Interesting.
Ours too, it was like we wore that like red. It wasn't like red, it was like that burgundy color for optometry for Western. And then we always had to wear that color and so I have PTSD now from that color.
So you like never wear that in practice?
Yeah, I hate wearing that color. And everyone's like, it looks so good. And I'm like, no, I can't, because it just reminds me of like clinic and like trauma.
Dang, that's tough. Because that honestly is a great color.
Yeah.
I love burgundy.
I'm gonna go with like maybe like a light blue.
As the least?
Yeah.
Okay. JD, what would you say? Most trustworthy, least trustworthy?
I think I'd guess green as least, because like maybe people just think outrageous colors, there's like a lack of trust or focus, or maybe it's too out there. I don't know. I'm just guessing here. And then the other options were, we said green, navy, black, and what was the 4th one?
Green, navy, black, light blue.
Most trustable. Let's go navy. Maybe something darker, more simple.
Colors. Okay.
You should get tested then. We need to do some color blind testing on you.
To me,
Wagner.
it's about personality. It's what's on the inside and not what's on the outside.
Okay,
Someone's
so
not gonna-
they broke it down. Like
okay.
females, males. Let's start with the females, right? So they have 4 different categories. I think 5. There's representativeness, trustworthiness, skill, compassion, and knowledge. So in the representativeness, the most representative was light blue, and the least was black.
What does representative mean?
As a doctor, as a nurse, I would take it that way because I don't know what that really means. But same thing. Most trustworthy, light blue. Least was black. For skill, the most skilled, light blue. Least skilled, black. Same thing for compassion and same thing for most knowledgeable. But actually, no, the least most knowledgeable was the green. So JD, shout outs to you on that one.
As I wear green on St. Patrick's Day.
But isn't it interesting that patients perceive people based on colors? Like this dude, like this doc might know a lot just because he's wearing light blue. Or I guess her in this case because it's a female.
I will say representing yourself well matters. Like the days I would go to clinic where we'd have like casual Friday, or like days where I would dress up nicely because I had to go to a meeting or something with slacks or something. People would always like walk in or say compliments, or like they treat you differently, or there's like a different level in the air. I don't know if you feel in the air, just of like the vibe of like, yo, they're impressed with what you're saying or like how you're coming off. Whereas like I was saying, I wear Crocs or something, or people then commonly maybe ask, hey, how long you been practicing, or how old are you, or you look very young, like little things like that matter. And so I guess the color can matter to certain people. I guess it resonates with certain people.
Yeah.
That makes a lot of sense.
Do you think that like TV shows have a lot to do with that though? Like making it seem like they're more knowledgeable? Because I feel like every time that I'm watching a Grey's Anatomy, they're always in like blue scrubs.
I do think that
Do you
that
think they
has to
just
do with
think
it.
of that like a typical doctor's outfit, like somebody who is like knowledgeable wears that outfit because they've just been like fed that information their whole lives?
As our
Psychologically,
That's probably part
subconscious.
of it. All his boys like blue. You said you were pink, right? That goes to that as well. We've been fed that our whole lives.
Yeah. And yeah, even on the men's side, the light blues, the navies, those were higher ranking. The highest ranking and most trustworthy for men was navy. Second place, light blue. Third place, green. And last place, black. Most skilled for men, light blue. Black was in second place, interestingly enough. Navy and then green. No one likes this green.
Wow,
JD, I'm sorry.
look at this.
Look at that.
Wow.
Right?
For those of you that can't see, it is Grey's Anatomy, and they're wearing
The
navy blue
women
or
are
light blue.
wearing light blue. The men are wearing black. There's two men wearing black, and then
No,
there's
it's
like
I think
one
it's
guy.
hard to see. Though it's like a navy.
Oh, is it navy?
Yeah, it's like a
And
navy.
then one guy's got a doctor's coat with a white coat and
Yeah,
slacks.
that guy's in charge.
He's bows.
That guy's not doing clinical work. He's in an office somewhere, probably.
So, with all of this, some patients get white coat syndrome. Have you guys ever experienced that? And do you wear your coats at all in clinic because of that or not because of that? Tell me about it, JD.
I don't wear my coat because I want to be approachable and chill, like you're saying. And I feel like I don't feel the need to like I don't want to say prove myself, but like I want to come in and be like someone they're comfortable with and talk with and joke with. And I feel like the white coat just kind of takes away from that. And so that's why I don't wear it. It doesn't create the vibe that I want. When I say I'm Dr. Sony and then I still talk to you like I'm a human or a friend, I feel like me saying I'm a doctor and establishing that already does that for me. What do you think, Nadia?
I save my white coat for very special people who maybe will undermine me as a doctor and being in charge as a woman sometimes.
So how do you know? Or when they undermine you, then
Yeah.
you walk back out and then walk back in with the white coat?
So my texts would like warn me about like this guy, like he saw, because before I had an office where I would see Dr. Dave's patients because he like not retired, but he was doing more admin stuff. So his patient load got to me and they'd be like, oh, is the doctor, they would either like say something like, oh, is the doctor a woman? Or like, oh, it's not Dr. Dave or something like that. And I'd be like, oh, time to throw on the white coat. So, but it just makes it feel like heavier, I guess. But yeah, normally I don't think I've had to wear it in this office at all.
I'd like to see a study of like who that had more of effect on. Did it give you more confidence to do the exam better and feel confident, or did it give more an effect to the patient to establish that you are a doctor and that you're kind of at this Dr. Dave's level? I wonder what had more impact on who.
Yeah, that was going to be my next question. Like, did you feel that patients kind of responded to the coat and gave you more respect? Do you feel like you get more respect, or do you just feel like you have more confidence, like JD's saying?
I want to mention that when I was a student, okay, let me start this over. So when I was in my first year of school, I noticed that like FIGs, I'll name names, right? They didn't have like a lot of optometry like represented in their general like campaigns, right? And I was like, oh, they have like all the other professions and optometry is not one of them. And I used to like really go after them. Like I would always be like, oh, optometrists wear scrubs too. Or like I'd always like tag them in things so that like we would have this representation. And I think it goes to like a bigger conversation where like we're left out of a lot of things about the medical profession, right? And I early on I really tried to advocate for that. Like even if like this sounds really stupid, but like Joanne Fabrics, they were like, oh, the optometry is not on the doctor's list for like the doctor's discount. And so I had to like reach out to their office and be like, hey, why not? And then they ended up adding us. But it's like little things like that in general. And I remember that everyone would make fun of me because I would like be like, well, things like optometrists wear scrubs too, because up until recently, we weren't really wearing scrubs in clinic, like unless you were in like a hospital setting. Like optometrists were mostly known for not wearing scrubs, right? Like I think after COVID, we've kind of shifted more into like the scrub kind of like nature of like just outfit wise in general. But before that, I think we were all wearing like business casual. Like I was wearing business casual to clinic. Everyone was like, oh, we're only wearing like our white coats with like the short white coats, to clinic and stuff. So there was no way of like discerning us, I guess, in that way. And that's why we had to wear the white coats because sometimes business casuals like are you front office or like are you the doctor, you know? So I think in that sense things have like changed in a different direction in the last, I would say like 5 years or so. I don't know what your thoughts on all that, but
Well, if you want to answer the question first, you can, and then we can go there too.
what was the question again?
Was it about the white coat?
Yeah, just when you would wear your white coat, would you feel like you would get more respect, or did you feel like you just had more confidence to where it didn't matter?
I just feel like it's a respect thing because I think that I'm very confident in my knowledge and it doesn't like just because I'm wearing my white coat doesn't mean I'm going to treat the patient any differently. Like, oh, now I have my white coat on. Now I'm going to check your 20/20 vision twice. Like, you know, like I just feel like it just is a way. I think it's also like an age thing because like if it's like a young person, I think yeah, they're getting a lot of anxiety, like white coat syndrome. I think for a younger generation is a little more like relevant. Whereas like if I have like an old white man that like, you know, like at the VA, like I feel like I would wear my white coat more, you know, just to be like, hey, how are you? Like this means something, you know, because our white coats do mean something. Like we earned those.
Right.
Did that answer your question?
It
It
did.
did.
It did. And thank you for
Okay. All
going
right.
there.
Thank you.
Now, this is something I've started to think about because before this, like learning about this research and this, perception of colors, I didn't really think much about, the appearance of, first off, the color you're wearing, but secondly, what you're wearing with that. So I like to wear like sneakers, scrubs. So kind of like Jordans and Nikes, things like that. Do you feel like patients, because I know it depends on if you're young or not. Obviously, I feel like young patients would like be more inept to that. But do you feel like older patients or just in general would treat you a different way if you just had, you know, Nikes or, whatever else type of shoes rather than some regular running shoes that most doctors have
Yeah,
on clouds or whatever?
yeah. I mean, it matters. Like, one of my patients today, for example, I had me a card, and he was like, "Oh, by the way, if you need to buy a house, let me know." And so I saw his card; and it was dirty, and I was like, "Do I trust this guy to sell me a house if he can't even keep his cards clean, right?" And so the same question applies to us: if our shoes are not clean, if our attire is dirty, like, do I trust this guy with checking my eye health?
Can't even take care of yourself. How are you going to take care of me?
Or maybe it's one of those we're stereotype, right? Like I can't even write. I always write prescriptions when we do contacts and glasses, and they can't read anything. They're like, okay, yeah, we
Yeah.
just expect that from you. You
Yeah,
know,
your
you can't
writing
read your.
sucks. You got true doctors writing.
Yeah,
But I
yeah,
think
but
that's
then
expected, like
yeah,
doctors
yeah, it
writing,
actually
right?
makes it feel more credible.
Oh, wow. I'm going to start being floppy.
You should see my signature. I don't even read it now. I just signed some dirt on there. They put my license.
Not you. Your
What?
take? Sneakers on clouds,
Hoodies.
hoodies.
Yeah.
Hoodies can work, especially if they have eye care attire on them. People like it.
Absolutely not.
Bondable.
Absolutely not. If my doctor came, okay, Steven had this jacket and it was just like a zip up jacket with like a hood, right? And I was like, you cannot wear that to work. And he's like, I like wearing this. It's cold there. And I'm
Was
like,
it
it
zipped
looks like,
up? Like
yeah,
was it,
no, a zip up. It would just be unzipped. And I was like, you look like you just look like you're not the doctor here. Like you gotta dress a certain way. Like you can't be wearing that. Like get a scrub jacket or like if you're cold, like get something that's appropriate to wear on top of your scrubs. Or like I told you guys, hoodies don't look professional. It looks like you're taking the SATs and then you decided like now that I'm done doing that, maybe I'll come check your eyes. It's like, no, this is a professional setting. Like we have to, come out a certain way. You can't come in mechanics clothes. I'm not coming in roller skates. Like there's a certain dress code that you need to be like wearing.
but like
Oh,
you said, since COVID, to be devil's advocate, since COVID, things have gotten a little more lax. We're able to wear scrubs. We're able to, chill out a little bit
I
more.
wouldn't say
So
scrubs
why
are
not
lax though, and that's like not an argument. I think
I
it
think they
depends.
are.
More lax.
compared to
Oh my god,
traditional
stupid.
business cash? Like, yeah, dudes used to be dressed up. Like I remember first year for sure, I had slacks, you know, the gaiters with the tie, real fresh
Yeah.
compared to scrubs.
The way I
Scrubs
see it,
feels
if
like
I'm more
pajamas.
comfortable going in the room, and that allows me to be more comfortable to see more patients, and then I'm in my best confident self because I'm confident self because I am comfortable. then my demeanor and all, like the way I talk to people and the way I treat people and the way I do the exam will carry over even if I'm wearing a hoodie.
Mhm.
I don't think it's that much of a deal breaker. Like, I think if you were act like you're like a
I want you to
non-professional,
imagine that you are going to your doctor and then you're like getting a consult for like surgery or whatever. Like, I'm trying to imagine like my OBGYN coming in a hoodie and being like, "Hey, what's up? Can you put your legs right here?" Like in my head, I'm like, "Why are you wearing that?" Like, it's just so like unprofessional. Or if they're like, "Hey, how are you? Let me throw on my hood. Hey, that all came back now looking so good, you know." I don't know, it just like it's like this is not a place to be wearing that, like, you know.
But what again? Well, let's say, what if it's really cold? Like, let's say, you're
Get
waiting, right?
wear your white coat.
You always sit there and you wait for the doctor to come in. You're in the room and you're freezing. You're like, yo, it's cold in here. The doctor comes in with a hoodie. Be like, oh, it makes sense. It's cold in here.
I don't think it makes sense.
what if
It
the
makes sense.
OBGYN had a photo of something to do with her work on
Right.
Like
It's
these
like
Right.
there's like
babies?
the ovaries go like this and they're like little heart.
yeah.
Then it's okay.
No.
It's like
Imagine they're like to
it's my
scoot forward,
doctor.
more forward. They put their hood on.
And we can do without the hood. You know,
I never really thought about this.
wearing the hood is
A
kind of
hoodie.
crazy.
That's the whole point of them. They have their hoodies.
So comfortable.
It's like the hoodie keeps my ears like
What about
cozy.
jeans? Like, would you show up in jeans?
On casual
Friday. Casual Fridays, Jean Fridays.
General. Like, would you show up in jeans? Like, if your doctor was wearing jeans and they came in like jeans and a hoodie, would you think that they were like working that day?
Is
would
it Friday?
you, like, very
Is it
irresponsible?
Saturday?
Fine. We're not like dealing with blood and stuff. Like we're prescribing or calling in stuff.
No.
Like, how much are you physically doing? Like,
Okay,
maybe
imagine
take
you get on an airplane and the guy who's flying your plane is in a hoodie and jeans. Like, how are you feeling about that?
It's probably cold up there.
We've been branded to think they have a attire. Like, if people actually wore stuff like
Have
that.
a uniform, right? It's like
Yeah,
this is
yeah.
like that's your uniform, so you can't. Hoodies are not part of the uniform, guys.
But do optometrists have a uniform? Do we actually have a uniform?
Yes,
Technically, no.
medical.
I feel like if I was in a private practice, I wouldn't do it. But for some reason, being in corporate, I'm just like, I think it's fine. I don't know if that's like a
To
stigma.
wear a hoodie or
to wear a hoodie with scrubs. Like, I don't think I'd wear like scrubs all the time if I was
What's
in
the
private practice.
difference? Like, what do you think?
I don't know. But private practice, I feel like you got to like take more time. Like, you got to like be more presentable. With corporate, I'm just being honest with you. I just like, hey, I got to see 30 patients a day in 8 hours. I got to be comfortable. You're gonna like, you're gonna come here, and I know you're gonna
That's
come
what they're
here.
paying you for, to like put on a tie versus not put on a tie. Like they're like, sorry, this is
Am I talking out or am I crazy?
getting a hoodie.
Am I crazy? I don't know.
You know what?
I think because private practice people,
Give
like,
me a second. Hold on.
you have to sell people to like buy glasses and stuff, right? So like, you got to be more presentable. You got to like take that personal customer time. Not that I'm not taking time to talk to people. I just know I'm gonna have a full slate of people whether I'm wearing scrubs or not. As she left,
I definitely get you. I don't know if I would wear a hoodie while seeing patients.
even the this one.
Yeah.
Dang, that's crazy.
While seeing patients, nah, I wouldn't wear a hoodie. I mean,
Fair
yeah,
enough.
I would, but before and after, for sure.
It's different. Okay, so Nadia's wearing a hoodie. You're wearing a hood. You're not supposed to wear the hood.
Yeah, no one's wearing
Come
the
on,
hood
you're
during
obviously
clinic.
the way you're carrying yourself. See, it's not just you could wear any clothes in the way your body language.
I was sitting like this the whole time before.
No, you
No, you weren't. No, you weren't.
Rewind the pod. Rewind the pod.
You're dramatic.
I was sitting like this, and then I was sitting like this.
Tell people what you're doing right now, just in case they can't see you.
It's not the same. It's a different perception. How are you looking at me now that I'm wearing this?
Put the hood down though. Nobody's gonna. Yeah, you're all doing this. You're all leaning back. Like, come on.
This is how I was sitting.
Nadia's wearing a hood for anybody who can't see it.
Who with the hood on?
But she's also changing her body language to make herself look a little more ridiculous.
And your hoodie has nothing to do with optometry. Like JD said, you're wearing an optometry hoodie.
It's a Knights hoodie.
With the Ferrante.
Vegas. I live in Las Vegas. Everyone loves the Knights. I'm representing my community.
I don't know how much people care about hockey in Vegas.
A lot.
Okay.
Yeah. This is actually from my undergrad, but also...
You should wear it to work tomorrow then.
I should, and then I'll tell you how it goes.
They'll be like, what is that? That's not the right colors.
Do you feel like you struggle with trying to establish credibility, like maybe dressing up and wearing the white coat? You got to do stuff like that.
No, I'm just saying that I wouldn't wear a hoodie. This podcast should just be named Hoodie.
I mean, it is a thing that women do get treated lesser than, and they kind of get questioned about their competency and things like that. Like, oh, you're the doctor? Which I'm sure you've gotten that a lot, right, Nadia?
How often do you get it? 1 out of every 5, 10?
I think that like at the beginning, I just walk in and be like, "Oh, hi, Kimberly, how are you today? Like, let's talk about your eyes." And then at the end, they'd be like, "So when's the doctor coming in?" And I'd be like, "Well, that's me." Or like one time, I was like giving the guy his contacts, and he's like, "Are you the doctor?" And I was like, "Yeah, I am." So then after that, every time I walk in now, I'm like, "Hi, I'm Dr. Afghani. Nice to meet you. How's your eyes been?" So that they know.
Mm. So initially,
I
when you first
haven't
started
gotten
practicing,
to look too young to be my doctor in a long time, so maybe I'm just looking old now, but
you used to get that before.
a lot more, yeah.
I got it today, but then I was like, okay, but yeah, like, and then they asked me, everyone single one asked me how long. I asked them, how old do you think I am? And then I told them the truth, I'm 31. And then I was like, but crazy enough, I've already been working for 5 years. And then like that seems to, oh really, 5 years? That's a long time.
Yeah.
But yeah, sometimes they'll be like,
Were you wearing your hoodie?
I wear my hoodie. It has an auto refractor balloon on it, just in case you can't see it.
I think that adds to it, though, JD.
I think it adds to the perception of the age thing.
Mm-hmm. Have you ever had people question you, like, "Oh, when is the doctor coming in?" Or
Never.
even
Not
when you
often.
first started practicing?
That's a good question. I'm gonna say no.
That's fair.
I don't know if it's because I'm bigger, it's because I have facial hair, because I'm a guy. I think all those things play in a factor too. And I carry myself confidently well. And so that's why I feel like I'm fine with those kind of things.
I think I hear once a week, "Wow, it's so nice to see a woman doctor, optometrist. All my other optometrists have been men." And I'm like, "That's crazy."
But that's a good thing, right? That's
Yeah,
not like a bad thing.
times are changing. I mean, I know we had that podcast where like women are like now dominant like sex and
Optometry.
graduating
Yeah.
classes. But yeah.
Well, all in all, I think we had a really good discussion today. I think we learned a lot about colors and hoodies and what not to wear. What are some takeaways that you guys can take away and give the people before we round out today? Nadia?
I'm only gonna wear blue strips from now on. From Fabletics.
Shout outs to
I'm gonna
Fabletics.
name drop because
Those are our people.
topic.
We
And
rock our
not wear
Fabletics.
hoodies to my job.
So no hoodies in blue. Are you wearing light blue or navy blue?
It seems like both are good options. Light blue seems to have one.
Light blue did win for females.
My heart.
Lady, what are some takeaways, some last minute things you want to say?
How you carry yourself matters, whether it's how you smell or how you showered or what you're wearing. But I also think it goes deeper than just like where you're wearing like a hoodie or not. I think it goes to like how you confidently speak and how you're giving eye contact, how your EI is. And so all that stuff adds up. And so obviously if you can do that, including not wearing a hoodie or looking professional, great. But I think it's the whole picture that matters when you're speaking to a patient. And so just keep that in mind.
Yes. And so, can you judge a book by its cover? Yes. Should you? No. Will you? Will they?
Probably.
Yes. So make sure you look on point, look the part, but also play the part. Like JD just mentioned, keep that confidence high, talk clearly and elaborate, explain things thoroughly, and look good while doing it. Have fun. We did another one, guys. Shout outs to the Depth Perception Podcast. Subscribe, smash the button, like and subscribe, all that stuff. Till next time. Peace out, y'all.